Hi, and welcome back to my channel, Learning Biology with Dr. Vanessa. In today's video, we are going to talk about heart attacks. What is a heart attack? What are the signs of a heart attack? Before we do that, I want to talk about what the heart does so that you have a little bit of an idea of what the heart does before we talk about a heart attack. The doctor in my name is because I have a PhD and not because I'm a medical doctor. So this is not to be used in any way as medical advice, but for educational purposes only. My goal is to help increase health literacy, to help others learn more about themselves and be able to make better health decisions and be aware. Before we get into talking about what a heart attack is, I want to talk a little bit about the heart and how the heart works and what it does. The heart sits in your chest. It is basically the center of your body as well as the center of the circulatory system. About the size of your fist, the purpose of your heart is to pump blood all over the body. It is made up of a muscle tissue called cardiac tissue, and this muscle never stops working. It is always pumping, always pushing blood throughout the body. So it's really important. What's the purpose of blood? The purpose of blood is to bring oxygen to all the cells in the body, to bring nutrients there, to remove waste, to make sure that everything is kept in balance. So it's doing a lot of work, and the more we use our body, the more our heart has to pump in order to get oxygen and nutrients to the different parts of the body. The right side of the heart gets all the blood from the body, and that blood is referred to as deoxygenated, which means that blood has already gone out to the body. It has dropped off its oxygen, and now it's coming back to the right side of the heart. So you'll always notice that anything that is deoxygenated is always depicted as blue. However, side note, blood is not blue. Blood is actually red. It's all red. Some of it is just a darker or a brighter red depending on how much oxygen it has. So blood isn't blue, but we always show deoxygenated blood as being blue. And that doesn't mean that all the oxygen is gone. It just means that there's less oxygen. So deoxygenated blood goes into the right side of the heart, and then it gets pumped to the lungs, where it picks up oxygen from the air that we breathe in, and then it actually goes back into the left side of the heart that you'll see in red, because that blood is now oxygenated because it got oxygen from the lungs. From the left side of the heart, the blood is going to get pumped through the aorta, which is the largest vessel in the body. Now, if you want to know more specifics on how blood is pumped through the heart, you can see my video on how blood flows through the heart, where I go through that in detail. So what is a heart attack? Not only does the heart push blood through it to travel all over the body, but as you'll see on the outside of the heart also receives blood for itself in order to keep the heart muscle alive. Remember, it's really important that the heart is always pumping. So a heart attack is a blockage of blood flow to the heart muscle itself. If the heart itself is not getting blood, then the heart is not going to be able to pump, because the cells of the heart need those oxygen and nutrients in order to survive. So when one of these arteries gets blocked to the heart itself, that is referred to as a heart attack. Now, a heart attack is a medical emergency and needs to be seen by a medical professional. They are very common, though. There's about 3 million cases in the United States per year. Now, the reason that this blockage occurs in these arteries is because of plaque buildup that can be due to high cholesterol, high fatty diets. One of the things you may not know is that when we digest our food and our body takes up all those digested materials, fat is the one thing that does not go directly into the bloodstream from the intestines. Fats actually get taken up into what is called the lymphatic system, and they go straight directly to the heart, get dumped in the heart, and then they start to circulate. So fats is the one thing that doesn't go into the bloodstream at the intestines. It actually gets taken to the heart. So the more fat, high fatty cholesterol foods that we eat, the more it's going to have that tendency to build up in the heart. If those arteries get full of plaque and have that buildup, then that can stop the blood flow to the heart or reduce the blood flow to the heart. So the heart attack can actually happen because of reduced blood flow or because of completely stopped blood flow. Symptoms of a heart attack can vary. Some people can have very mild symptoms. Some people can have more severe symptoms, okay? Symptoms can include things like a chest pain, where there is a tightness in the chest, like a pain, pressure, or squeezing. This pain can actually go up into the arm and shoulder, the back of the neck, the jaw, things like cold sweats, fatigue, heartburn or indigestion, lightheadedness, nausea, or even shortness of breath. Sometimes women can have atypical symptoms compared with men. But if you are experiencing any of these symptoms, the time is of the essence. The faster you get this checked out, the better the outcome is going to be. Heart attacks can result in immediate death. Some are much more mild and can be taken care of. The best way to prevent this altogether is to have a good, clean, healthy diet, eating healthy foods that are good for the heart. So here are some suggestions for healthy foods that you can eat. Thank you so much for watching my video. I hope that it sheds some light on how the heart works and what a heart attack is really affecting. If you have any questions or comments, please make sure to put them down below. If you have any ideas for another video, some topic that you want to see, also let me know that as well. If you like this video, please make sure to subscribe to my channel and click on the notification bell so that you never miss out on a new video. Thank you, and I hope that through these videos you are learning more about yourself and being able to make better health decisions for a lifetime.